On July 23rd, Folkhälsomyndighetens directives are decided to be the ones to dictate how healthcare is practiced. This includes tracking down infections. People who enter the country from abroad are recommended to stay 7 days in voluntary self-quarantine. A number of countries in the COVID risk zone have been added to the list. Great Britain is now one of them. On July 29th, Folkhälsomyndigheten presents a new study for measuring the presence of COVID in Sweden. 4,000 participants are to be invited, of which all of the participants from previous studies are invited. The participants get to basically do a PCR test on themselves, swipe their throats, nose and saliva and send it back. It doesn't state if all of these 4,000 participants are all healthcare workers and qualified and guarantee to do the sampling correctly. They state that this is to see if there's an ongoing infection, but also say that people who have already had COVID-19, such as all of the previous participants they have tested in previous studies, will not show if there's an ongoing infection. The armed forces of Sweden are financing this study. The study seems to be conducted in August. In August, school starts for the season, and this becomes a topic. On August 13th, media reports about Britain's quarantine for people inbound from France, sports, New Zealand's relapse after 100 days of corona-free, and sports, and Apple's removal of Fortnite from App Store. It's almost bizarre how there's suddenly no more pandemic, only elsewhere in the world. Here's August 14th and 15th. By August 13th, 80,717 cases had been confirmed and 5,766 deaths in total. September 2020. In September, this no news trend on COVID keeps on reigning media. On Monday, 28th of September, the trend of chlamydia during summer has decreased, indicating that perhaps summer festivals have been cancelled, less chances for getting drunk, and promiscuous behavior has also decreased among teenagers and young adults. It's just a guess. October 2020. More than 100,000 dead from COVID in India. Donald Trump left the hospital while he was sick with COVID to thank supporters. And now he's being criticized for it. A grenade detonated close to a house in Bromsten, Sweden. More than 2 times as many COVID cases in Russia as they had initially reported. 800,000 confirmed cases in Spain. 80 Van Halen dead from cancer. In October, the government also decided to give out help packages and aid packages to private business owners, small business owners, since small businesses were going out of business faster than other, for obvious reasons. And so they got critique because the first packages or aid they initially gave out, it was nigh impossible to get it and to fill those criteria, and it mostly went to people who already had money. But then they split up these aids into 2 parts, of which people who own businesses but not necessarily have a location for their business, meaning that they're not a hair salon with a business inside the hair salon. Maybe they do accounting and they do it from home. These people could also get aid. I could get aid. I started applying for it and I decided I don't actually need it, so I decided to not do it. But I am very sure that I would have got it had I applied for it. On October 6th, state epidemiologist Anders Tegnell states that the biggest COVID spreaders are age groups between 20 and 29 years. Here's a moral dilemma. Since it is initially we young folk, well, I'm not 20 to 29, but something a little higher than that, we're the ones spreading the disease, and yet we close the activities for our kids. We close schools and cancel events, and we imprison our elders at home so that we can move around freely, spreading the disease and prolonging this pandemic. In Uppsala, a city north of Stockholm, tighter measures are introduced and include recommendations to avoid commuter traffic, avoiding physical contact with anyone outside of your home. November 2020, the second wave is on. This is when interesting things start to happen. As municipalities have listened to the government, who has listened to Folkhälsomyndigheten, have followed their recommendations given to them by Folkhälsomyndigheten. After the autumn break, when people traveled around much, spreading the disease to counties and municipalities that didn't necessarily have as many cases prior to the holidays, the government now decides to let the municipalities take the reins in their own hands and decide regarding restrictions as they see fit. This, however, happened after a rather embarrassing press conference with Folkhälsomyndigheten, where masses of journalists all over Sweden, one after the other, got to ask Folkhälsomyndigheten basically the same question again and again. To which Folkhälsomyndigheten had no answer, or chose not to answer and instead gave some pseudo-philosophical vague half-answer, or simply answered another question which was never asked. Why is this text in English? This was so embarrassingly obvious that it is my theory that the government wanted to put them on the spot as the ones who have done nothing and misled the population, and not the leading government, even though all parties, including the opposition, was backing up Folkhälsomyndigheten to take over. On November 1st, there are 133,332 confirmed cases in Sweden. By December 1st, that number has grown to 266,886. By December 31st, the number is 454,851. What happened here? Well, in these times, the Stockholm municipality offered free PCR tests for people living in Stockholm. I took one myself prior to leaving for Finland. These tests could be conducted at home. A taxi driver brought you the test and picked it up. Some moments later, you spat, snotted and gagged onto a cotton swab and handed it over. In a few days you got the answer. The time varied. I personally got my test the day after I ordered it, and the results the same evening after I handed in my test. Very effective. Good work. New restrictions were introduced. The number of guests at restaurants were decreased to 8 at a table. Gatherings were restricted to 8 people. Before, the restrictions were 50, and these were only in certain circumstances. These circumstances did not include performances and musical happenings, shopping malls, for instance. These stricter measures were welcome, but they came in too late, and the second wave had already begun. The COVID cases soared, and by the beginning of January, more than 500,000 people had tested positive for corona. The death toll doubled as well, being 6,025 on November 1st and 12,258 on the 1st of February. Now, let's skip ahead and jump right into 2021. December and Christmas went by, and now the government is yet again at a place where they need to make a choice before the third wave. So the third wave is at the door, 1 year later than the first wave initially started here in Sweden. And I am, it's wrong to say excited, but I am anticipating on what's gonna happen when the government actually takes 2 measures before the third wave hits, and how that is going to affect the evolution of COVID in Sweden. I'm the Finn who feels optimistic in Sweden at the moment. And just when I was getting positive in that previous recording. So the government pretty much was talking about how they're gonna start implementing restrictions and measures and tighter measures. And now they're sort of like that, thinking about maybe doing so. What happened? Once again, they hesitate on taking measures. Apparently, the third wave has already hit Stockholm pretty badly, and nothing is still done. And I don't really know where we're going with this. Are we doing anything, or are they again gonna wait until it's too late, as they did the time before that and the time before that? So according to Social Minister Lena Hallengren, the government would not suggest restrictions if they were afraid to actually implement them. Stricter measures would include closing down gyms and shopping malls and restaurants and etc. And they're still debating on whether they can do that or not, or whether they will do that or not. But they are very prepared to do that if necessary. They're waiting on if it ever becomes necessary, such as if the shit hits the fan and we have a new outbreak, then they will take measures. The newspaper asks Hallengren why we're not doing anything when neighboring countries, in this case such as Finland, are trying to close down sections of society before the shit hits the fan. And she answers, Finland can describe their own situation and why they want to do what they want to do. It is not a dead giveaway that restriction always leads to a bettering of the changing of behaviors for the better in people. You can have a backlash as well. Who says something like that? But she also says, but it's not like we're sitting here and doing nothing and waiting for shit to hit the fan. She answers, I understand the question, but I want to underline that there are pretty big areas in Sweden that are already more or less under lockdown, even if it's not a formal lockdown. Such as which place? So at the end they ask, could the government and authorities communicate better? And she answers, one can always be better, but does that mean that you should communicate more? What the fuck? This kind of yappity crap is why big newspapers even put this shite in here? It's unnecessary. It gives out nothing. This is no information whatsoever. So, I am not completely negative. I hope to cripes that this pandemic is going to see better days soon. But also because I kind of want to fudge out of here. We'll see. The way things are going right now, this is going to take like 2 or 3 years, and Sweden is going to be the absolute last country to give out vaccines and to have, be pandemic free.